Hi, my name is Dr. Nader, and I'm here to talk to you about TMJ and potential sleep apnea and how we can help with those issues. I have a unique interest in care towards TMJ and sleep apnea, mainly because I'm also a patient. And I've struggled with it many years ago, and I've found ways to help alleviate and manage these types of concerns and these symptoms. And I'm here to help with our patients and with anyone who reaches out to us, and I wanted to share this knowledge. We use this mainly to address a lot of the common symptoms such as headaches and migraines and head pain, but we also address this before we get into any type of complicated dental work. We want to make sure that we want to minimize any risk of failure, of things tripping and breaking down the road, and we also want to help our patients get out of pain and manage the headaches. So how do we recognize the first signs of TMJ? The most common one is tension type headaches, which is very, very common. There are other symptoms as well, when the jaw locks or when there's pain in the joint specifically. We also look at if there's a lot of grinding and clenching, if there's a history of broken teeth, if things are currently wearing down or breaking. And there's other symptoms as well that are not as common. For example, if there's ear pain, tinnitus or ringing in the ears, and a lot of times, things could be clear in the ear. However, these symptoms do persist. So how do we get a diagnosis? What's the first step? Well, the very first step is a very initial assessment. And this typically can be done over the phone. It's a one-on-one call with myself or someone on the team here, where we just assess some of the basic symptoms and see if this is something that can help. Typically, there's a questionnaire at that point that we would give out. It's a very thorough questionnaire. It gives us a lot of information. And this call takes about 30 minutes. The second step, if this is something that we can help you with, we do an in-depth, in-office, full head and neck assessment where we go through, we check the airway, we check all the muscles of the head and neck, we do some imaging of the jaw, we measure the range of motion, we do a lot of photography, and we help to determine a diagnosis. From there, we take a scan for the appropriate orthotic that may be required, and this appointment typically takes just under an hour. Now, there is a range of treatments that can be applicable, but we always start with reaching out to some of our referrals. It is a multidisciplinary approach, and we already have those contacts in place in the community. We may need to reach out to a head and neck physiotherapist, a vestibular physiotherapist, or a chiropractor, or even a head and neck massage therapist. If we suspect that there is a sleep-related issue, then we would reach out to the family doctor to help us with a referral to a sleep clinic. From there, we work together so that we're able to put together the right diagnosis and figure out the right combination of treatments to help someone get them out of pain. We create a custom treatment plan to meet individual needs, and so we're able to improve symptoms. So in closing, please give us a call. We can help with a one-on-one conversation with myself or someone on the team, so we can help get to the bottom of these headaches and related problems, and then so we can able to help you manage them. Thank you very much.